Good morning from Paris, and I apologize not being able to come to Abu Dhabi. My name is Denis Barritault, and I had an academic career for 36 years at the University of Paris and quitted the university to start up a company to develop these promising agents, and now which I'm going to present this technology of RGTA. And I'm going to present the use of these products through a case series on 13 patients with COVID-associated respiratory symptoms treated with nebulized OTR-4120, which is from a commercialized wound healing agent called Kasiplic 20. What is Kasiplic? Well, it's a commercially available product designed for skin wound healing that contains a polysaccharide engineered to mimic and replace heparan sulfates in an injured tissue. It exists commercially on two presentations as a kit, which is a CE mark kit of 5 ml vials containing this solution of OTR for 120 at the same at 100 micrograms per ml, which you apply on a gauze to the wound, and as a spray which you directly applied on the wound. Now, this is bound to stimulate speed and quality of tissue repair in diabetic foot ulcers, other chronic wounds, hard to heal wounds used in aesthetic burns and acute wounds. There are over 200,000 patients. It's well known in the area where we are in UAE and Saudi Arabia. And if you want to know more, there is a poster 196 that shows the cases which are on skin. But my focus would be to explain to you what is the rationale and the use in the case of lung injury. Now, heparan sulfates is an ubiquitous glycosaminoglycan present in all tissue in the extracellular matrix, and its function is to organize, control the scaffold. It binds to the matrix protein, the binding site of heparan sulfates, and it links to the other matrix protein so that it makes a scaffolding. And it also has a second very major property. It interacts and protects stores all these growth factors and signals needed to secure tissue homeostasis. And this protection secures the quality of tissue homeostasis. That is, when a cell dies, signals its death through its death through apoptotic signals, triggers the multiplication and migration of the neighboring cells and replace exactly the dead cells. So by the end, you have an equilibrium and you have a perfect regeneration. However, when there is an injury, the endogenous heparan sulfate is destroyed, doesn't protect anymore the growth factors inside the wound, and it's replaced, which are destroyed, and the emergency signals brought by the inflammatory and circulating cells will trigger a process of emergency regeneration, which is a repair, which is a loss of quality, which leaves scars and traces. So therefore, you have a loss of quality called a fibrosis. And if you introduce this OTR for 120, which is a mimicking molecule of heparan sulfates, it will not do this because the heparan sulfate that it mimics it's shown in this slide here. The link in normal heparan sulfate is sensitive to glycanases degradation, while here we change into an alpha-1,6 which resists to heparanase, so that it will maintain the structure, it will resist to glycanase, it will allow the growth factors to be stored and protected again, and therefore it will restore a microenvironment that will favor the process of tissue regeneration and repair. So by using this biomimicking approach, we will preserve the natural information of the microenvironment of the cell of the injured tissue and restore the conditions for a regeneration process. And as you understand, you've seen on the skin, this is a general property, and with the whole thing is to find the right timing for introducing this product. And the affinity of this to the matrix protein, of this OTR to the matrix protein, is such that it's even better or stronger than a good antibody to an antigen. So it's in the nanomolar KD range, and it will just target to the site of injury and nowhere else. So by introducing this product, you may expect a very acute and very specific process of tissue repair, which was applied in a model of blamomycin-induced lung fibrosis in a mice model. And here you can see that the lung index, which is the fibrotic type of index, which is in normal animals about 7.3, not affected by the molecule itself, will reach to about almost 10, but we reverse to about 9.6 with the introduction of the treatment of OTR3 after this fibrosis induction model. The same efficacy is seen with the alveotitis area, which is a sort of quality of the lung, which you can see at the histology level. And top of it, you have also on the collagen a completely shutdown of collagen 3, which is completely back to normal. And collagen 3, as you know, is a very important sign of fibrosis. Now, applied to patients when they have this Casiplic solution that they buy as a kit for wound healing, and they dilute it tenfold in water, they put it in a available home nebulizer, then you will see that this nebulization for about 5.5 days, or about 5 ml, 4.5 ml at a tenfold dilution, will have a very interesting effect. On this example, 13 patients which were PCR positive sarcoma, 8 moderate, 3 severe, 1 mild and 1 critical, 10 patients during acute phases and 3 post-acute phases, 4 weeks, above 4 weeks, were treated the same day as they had the CT scan. And the same day they received this by nebulizing twice a day, a 4.5 ml solution of a tenfold dilution. So practically 1 vial was enough for the full treatment, and 5.5 days. And that was enough to show that all the patient improved within 2 to 4 days with a mean value, which was very spectacular. Full clinical recovery ranged from 6 to 27 days with a median day of 6 days, because some patients did not completely recover. 6 received a second identical treatment in the following days, and then they improved very much. And the clear improvement was seen at the lung CT in most of the cases. The treatment was extremely well tolerated in all patients. And in conclusion, we believe this is a promising data for nebulizing OTR 4.20 to reduce severity and time to recovery. So reduce the time at hospital as well. These results justified further evaluation because we need, of course, to have a well-designed placebo-controlled therapeutic. It's a need for an RCT. And today there's about 30 hospitalized patients that still continue to give information, but it's still not yet an RTC. So those who wants to have more information, I just give this slide, but not going to comment it in this 8 minutes presentation, but it is on the website of the link to the article, and which is presented here, which is referenced in the abstract. And this is the example of quality that you get of the images, where you can quantify really the lung recovery, the repair with different reconstructions. And that's also, this is a severe one. You see what after 27 days, where the improvement was drastic, and you can see. So